Food insecurity is when people don't have enough money to access or afford suitable food. It is a serious and increasing concern in the UK, estimated to have affected 7.5 million people in 2024, and thought to have been worsened by increases in the cost of living. Food bank usage has risen significantly, and understanding the experiences of those living with food insecurity is important. We spoke with 18 food bank users in Lancashire to find out how food insecurity influences their lives and their families' well-being. There's lots of different factors that can lead to people experiencing food insecurity, often coming from circumstances beyond their control. Some people have been trying to cope by making changes to their eating habits to save costs, by choosing cheaper supermarkets, buying in bulk, and changing their diets, for example by eating more frozen, cheaper foods. People told us that their physical health has been impacted because they have had to eat cheaper, less healthy foods, with some people telling us they have had headaches, dizziness, and felt worn out. Having limited food choices and relying on frozen options or fast food also meant people were prevented from making healthy food choices. Parents have hidden their financial struggles from their children so they don't worry, and have made sacrifices to ensure their families have food, sometimes not eating themselves to make sure their children could eat. People have had to choose which bills to pay, and the worry has been an ever-present shadow on everything they do. Some people turned to family for help, but then felt it impacted their relationships with loved ones in a negative way. Many of the people we spoke to were reluctant to seek help from food banks, and it is often seen as a last resort. There's a sense of shame and embarrassment that impacts people's sense of self-worth and dignity. The support offered by food banks is often far more than just food, but getting there and back takes time and can cost money for transport, and there are limitations with what they can offer and what choices are available. Being weighed down with money worries and not having enough to feed themselves and their families has significant and long-lasting negative impacts, especially on mental health. People told us they weren't socialising as much and were withdrawing from friends and social activities, making it difficult to have quality family time too, all of which made them feel isolated and like they were missing out. People were grateful to the organisations, volunteers and staff who had supported them when they needed it most, but it was still difficult to deal with the stigma of accepting charity, and it made them feel helpless and like they'd lost control. The complexities of applying for benefits was stressful, and being paid just once a month made it difficult too. We asked people what they felt might help. People told us that having more mental health support, assistance in finding employment, accessible information, and more support tailored to their individual needs would be useful. More awareness of the support that's already available, but not always easy to find, would be helpful too. The consequences of food insecurity are far-reaching, seriously impacting both physical and mental health. Though food banks offer some relief, accessing food support carries significant personal costs. Individuals face internal turmoil and often feel they are, in many ways, sacrificing their dignity when seeking food support. There's a real concern that if food prices continue to increase, more people will end up experiencing food insecurity, as any one of us could find ourselves in circumstances where we may need to access a food bank.